Welcome to Cellular Housekeeping. I'm Amie Skilton from Bioceuticals. Today we're looking at how to improve overall health with cellular housekeeping through the provision of herbal and nutritional supplements utilising the body's own detoxification pathways. The HSCC program will demonstrate how to improve your patient's gut function, reduce toxic accumulation, and improve liver health and toxic excretion, resulting in clean, healthy, functional cells. We're going to first take a look at what toxicity is, what its definition is, and the different sources of toxic and inflammatory chemicals. We'll then have a look at the body's own detoxification systems, primary and secondary, focusing in particular on phase 1, 2, and 3 liver detoxification. We're going to have a look at each step and what can inhibit and induce these particular pathways and how best to support our body's own efforts in detoxification. We'll also identify signs and symptoms and which tests to run and commonly diagnosed and related diseases that relate to toxic overwhelm. We'll conclude the seminar with detoxification support and programs to help kickstart your patient's detoxification process, and also going forward, ideal programs for regular maintenance for optimal health. So starting with, what is toxicity? Toxicity refers to the degree to which a substance is poisonous and can refer to any substance that interferes with the normal processes of the body. Mechanisms of toxicity are widely varied. They can include interference with enzyme function, blockage of receptor sites or cellular transport mechanisms, mimicking of hormones or neurotransmitters, and oxidative damage. It was Paracelsus that first coined the phrase, "the dose makes the poison," but it's a little bit more complicated than that. Anything has the potential to be toxic, including such things like vitamins and minerals, endogenous hormones that we make, pro-inflammatory cytokines that are also produced in the body, as well as commonly understood exogenous sources of toxins. The tricky thing is the science of studying toxins, called toxicology, only looks at substances in their singularity. Now, in terms of individual substances, that's fine for a lab, but not so much when you're looking at the complex ecosystem that is our body. You also have factors like bioaccumulation, the rate at which we absorb and take in toxins, relating to the rate at which we're actually able to excrete and detoxify them. In addition to that, multiple sources of toxins actually have an amplifying effect. One example of this is a mice study that was done, in which one group of mice were given what is considered a safe level of mercury. In that particular group, only 1% of the population died. In a second group, the mice were given what is considered a safe level of lead. Same again, only 1% of that population died. However, in the third group that were given the safe level of mercury in addition to the so-called safe level of lead, within 5 days, every single one of the mice had died. This is a perfect example of how small amounts of toxins that on their own may not be such a problem, in combination can be very, very dangerous and in this case, fatal. So let's have a look at what is toxic. You have to consider both endogenous and exogenous sources. So starting with endogenous toxins, or those that are created or manufactured or found inside of us, hormones are a major source of toxins. As much as they are vital for life, they are a chemical that our body then has to manage and deal with and break down and excrete. Inflammatory cytokines are another great example of this. Chemicals that our immune system makes to mount immune responses also need to be dealt with by our liver and other detoxification organs. Chemicals like adrenaline and cortisol that are produced in stress also provide a source of toxic load from inside of us, as does oxidative stress. In fact, many metabolic byproducts, for example carbon dioxide, have a free radical damaging effect. Dysbiosis and LPS, or lipopolysaccharides, are technically not endogenous, although they're classified as such because they come from our gastrointestinal tract. Now, on the other side of the coin, we have exogenous toxins, of which it can be found anywhere in our environment, in our air that we breathe, the water that we drink, and the food that we consume. So things like pesticides, fungicides, and herbicides found on our fruits and vegetables are an issue. So are chemicals that may leach from plastics, like BPA and phthalates. Heavy metal poisoning is an issue both in food, produce, and in water. And some of these are in fact endocrine disrupting chemicals. Commonly added things to foods like caffeine, artificial sweeteners, artificial colours, artificial flavours are also an exogenous source of toxins, as are drugs, whether they are pharmaceutical and prescribed by our doctor or recreational. They form a source of exogenous toxins. Xenoestrogens are another source of toxicity from outside of us. There are 11 different kinds of xenoestrogens found in our food and water, which can lead to estrogen dominance, reduced liver clearance, inflammation, and ultimately the potential for hormone-dependent cancers. Occupational exposure is something that you also want to consider when looking at sources of exogenous toxins. So let's have a look at some of the more common sources of these. Water is one great example. Town water is typically treated with a number of different chemicals and in fact can contain anywhere between 100 to 10,000 more chemicals than natural spring water. Fluoride, mercury, arsenic, PCBs and dioxins are common contaminants, and some of which, for example fluoride and chlorine, are deliberately used to treat the water to either treat a health condition in the case of fluoride or to eliminate bacteria and fungi in the case of chlorine. Food is another source of toxins. I've already mentioned pesticides, fungicides, herbicides, antibiotics and antibiotic growth promotants are also another form of toxin found in our food. Many of these, as well as BPA found in plastic packaging, are endocrine disrupting chemicals affecting organs like the thyroid and also our sex hormone balance. Now, personal care products that we use on a daily basis, for example, toothpaste and things like deodorants, cosmetics and skincare also are a huge source of endocrine disrupting chemicals, as are other chemicals that we use around the house. So the things we use to clean our kitchen tops or windows or glass cleaners or disinfectants or the things we mop the floors with are also another source of chemicals. Now, we have a huge degree of control over these sources of exogenous toxins, but an area perhaps which we have very little control is that which is found in our air. So pollution from vehicle emissions, industrial waste are things that we're exposed to on a daily basis through breathing, which we then have to also account for when looking at the overall toxic load. Now, looking at occupational hazards specifically, a good case history is important to determine where someone might be being exposed to toxins in their job currently, but also looking back over their history where they may have actually had past history of exposure that may need cleaning up now. The phrase mad as a hatter came from the fact that the process that stiffened felt, which was used in hat making, involved mercury, which was absorbed and converted into methylmercury, which travelled to the brain, causing brain damage, toxicity, and ultimately causing hat makers to go mad. But they are not the only occupation that's at risk. Dentists in particular used to have the highest rate of suicide because the mercury amalgam that they used to inhale as a matter of business, everyday business, where they were putting in fillings for patients is a real issue. Hairdressers that use chemicals every day to straighten hair, smooth hair, fix hair, wash hair, condition hair. Forecourt attendants, perhaps not so much of an issue now, but petrol fumes on the forecourt are a problem, as are vehicle emissions for parking attendants. Miners have their own issues to face, as do beauticians and nail technicians, pest control, exterminators, farmers, those that use paints or glues or chemicals through the course of their job. Pilots and flight crew also have a particular unique risk in that their radiation exposure is very high. In the cockpit, it's much higher than in the cabin of the plane. However, a 4-hour flight is the equivalent radiation to a single X-ray. When you consider the kind of hours that they pull, weeks, months and years on end, it's a huge source of toxicity that their body has to deal with. Now, another category that's perhaps not as obvious are athletes. Through increased exercise and free radical damage, their body's own endogenous production of toxins is also a lot higher. So let's have a look now at lipopolysaccharides, also known as LPS. These are classified as endogenous toxins, however, are actually found inside the lumen of our gastrointestinal tract. They're becoming more and more recognised as the culprit in many inflammatory diseases. LPS-induced inflammation is a real issue in human beings, and the trouble is, LPS are large molecules found on cell walls of gram-negative bacteria. These include such bacteria as E. coli, which are a commensal species found naturally in our gastrointestinal tract. Now, the trouble with LPS is they behave as endotoxins, amplifying and exaggerating the immune response, contributing to systemic inflammation and greater oxidative stress. As a result, the increased passage of LPS is associated with a number of disease states, including endotoxemia, liver disease, depression and other mood disorders like general anxiety disorder, immune suppression and therefore increased infection risk, other things like allergies and autoimmunity, as well as arthritis and metabolic syndrome, are related to LPS-induced inflammation. In fact, cytokine sickness behaviour is predominantly driven by LPS-induced inflammation. Symptoms of cytokine sickness behaviour can appear to be, I guess, really anything in terms of condition or disease states, but can show up like this. Little motivation to eat, people who've gone off their food or just don't feel like eating for whatever reason. Listlessness through to fatigue and grand malaise. Little interest in social activities, significant changes in sleep patterns, and people with cytokine sickness tend to display an inability to experience pleasure and exaggerated responses to pain. You can see that these symptoms bear an uncanny resemblance to conditions like depression and chronic fatigue syndrome. And interestingly, LPS is one of the key culprits in the development and severity of alcoholic fatty liver disease because of that translocation across the gut wall. Now, the passage of LPS across the gastrointestinal tract is a major culprit in the Herxheimer or die-off reaction. And this was first discovered simultaneously by 2 different doctors who were treating infections with antibiotics. And in fact, the Herxheimer reaction was an indication to them that they'd found the correct antibiotic to treat the pathogen, because the death en masse of whatever the microbe was caused a major reaction, including a full body rash. Now, other symptoms of a Herxheimer or die-off reaction includes things like headache, nausea, in some extreme cases even vomiting. And this so-called healing crisis is an indication of, I guess, LPS and toxic overwhelm in the body. Now, there are a number of ways that you can avoid triggering off a Herxheimer reaction through the process of a detox, which we'll talk about shortly, and also ways in which you can actually help calm down that immune reaction. But it's an important one to look out for because it's a signal from the body that it is being overwhelmed by whatever it's dealing with. Now, in terms of addressing LPS endotoxemia, ideally probiotics will always be utilised because they help to reduce the number of LPS in the gastrointestinal lining and lumen, but also helps to reduce the passage of LPS across the gastrointestinal wall. Now, glutamine and mastic gum, by improving intestinal integrity, also help to reduce LPS translocation. Now, alpha-lipoic acid helps to attenuate any complications of LPS passage. Given that it's a fat and water-soluble antioxidant, you can see how it will reduce the oxidative stress that such a translocation might induce. anything that has an anti-inflammatory or an antioxidant effect will also help reduce LPS-induced cytokine production and the subsequent reactive oxygen species being produced. So things like fish oil, omega-3 essential fatty acids, things like curcumin, and also green tea and milk thistle are powerful at reducing the inflammation and oxidative stress LPS might cause. In addition to that, sleep plays an interesting role in addressing LPS endotoxemia. Any time that we have insufficient amounts of sleep, our gastrointestinal permeability is compromised, allowing increased amounts of LPS and general endotoxins to be, transported across the gastrointestinal wall. In that case, particularly in terms of a detoxification program, sleep and the energy that detox requires becomes a really important part of the whole overall program and a holistic approach to detox. So now let's have a look at our detoxification systems. And we'll start with the heavyweight champion of the detoxification world, and that is our liver. Now, the liver detoxifies metabolic byproducts, exogenous toxins, in a 3-step process, utilising phase 1 enzymes, followed by phase 2, and after that, phase 3 enzymes finish the job. So let's start with looking at phase 1 liver detoxification. This is done predominantly by the CYP450 family of enzymes via oxidation, reduction, and hydrolysis. This phase involves adding or exposing a functional group to a toxin, most commonly a hydroxyl group, in order to make it more excretable. In many cases, this is the first step in that process, during which phase 2 then has to actually reconjugate the toxin so it is able to be eliminated from the body. By allowing a toxin to be conjugated, this opens up a reactive site, which means if phase 1 is upregulated in comparison to phase 2, reactive oxygen species may cause damage to the liver. Now, it's interesting to note that cytochrome P450 enzymes are present in almost every single cell type. They're present in the lining of the gastrointestinal tract. They're also present in the lining of the lungs. They're also found in the kidneys and the cytosol, and of course, most importantly, found in the liver. What this means is, in some cases, using the lungs perhaps as an example, toxins that are breathed in are able to be detoxified and ejected by cytochrome P450 enzymes without the requirement for any further metabolism. Let's have a look at some of the things that influence phase 1 liver detoxification, starting with monofunctional inducers. Now, typically, these tend to be toxins, and they affect only one enzyme or phase of detoxification and dramatically induce or upregulate cytochrome P450 enzymes. Now, the impact that this has on the body and the liver in particular is there is an uncoupling of phase 1 and phase 2 balance. Some examples of monofunctional inducers can be things like ethanol or methanol. So alcohol consumption can affect phase 1, upregulating it out of balance to phase 2. Arylamines, which are found from charbroiled meats, are another source of toxicity. Polycyclic hydrocarbons from cigarette smoke. Medications like anticonvulsants or glucocorticoids. And things we commonly use in cosmetics like acetone or hydrocarbons can also upregulate phase 1. The issue with this is, if you consider phase 1, phase 2 and phase 3 to be a production line of toxic metabolism, anytime there is a build-up in one phase, you get a bottleneck with the next. And in this case, if phase 1 is working much faster than phase 2, the issue is intermediate metabolites generating reactive oxygen species, and in turn has the potential to create damage in the liver. There are, however, multifunctional inducers, and these compounds help to calm phase 1. In many cases, they also help to induce several phase 2 enzymes, helping to restore that balance and that coupling of phase 1 and phase 2 liver detoxification. They also commonly induce glutathione S-transferase and glucuronal transferases, which are an important part of toxic metabolism. Now, these include many of the flavonoid molecules found naturally in fruits and vegetables. Curcumin's a great example. Ellagic acid, which is found in red grape skin and pomegranate, is another great example. Garlic oil and rosemary and things like cabbage and Brussels sprouts are also fantastic multifunctional inducers. Milk thistle, which is a powerful liver herb, is also a great regulator of the balance between phase 1 and phase 2. I guess the take-home message from this is, however, whichever way you look at it, providing extra antioxidants will certainly help to protect in the event that phase 1 is unnaturally upregulated out of balance to phase 2. So how do you know what phase 1 is doing, what phase 2 is doing? Well, the functional liver detoxification profile is ideal for assessing and identifying any issues with phase 1 and phase 2. Looking at phase 1 liver detoxification, it's a fairly simple thing to identify and address. You either have upregulated phase 1 or an underactive phase 1. So in the event that phase 1 has been upregulated, what this is indicating is excessive cytochrome P450 induction, which most commonly occurs from exposure to things like alcohol, nicotine, caffeine, even things like stress or our natural stress hormones. Drugs also can upregulate phase 1. These may be recreational drugs or those that are prescribed for pharmaceutical use, like the oral contraceptive pill, HRT, steroid medication, antibiotics, barbiturates, and also exogenous toxins like vehicle emissions, paint fumes, dioxins, pesticides and herbicides. High-protein diets can also upregulate phase 1. Now, I'm not talking about protein-adequate diets, but I'm talking about protein being ingested in much greater amounts than is necessary for good health. Now, how to treat this? First of all, to help counteract the reactive oxygen species that are generated in response to this upregulation, all antioxidants should be considered, including things like vitamin A and vitamin C, vitamin E and selenium. Curcumin's also really important, and of course milk thistle, which has a regulating effect, calming the balance between phase 1 and phase 2, in addition to boosting our glutathione status. In severe cases, especially if there's been a Herxheimer reaction or healing crisis, you can consider grapefruit juice. Grapefruit juice contains a compound called naringenin, which is a powerful down-regulator of cytochrome P450 enzymes. This must be used with caution because it reduces drug clearance, so for patients that are on medication, it may not be appropriate. But for your average patient who may be finding that upregulation of cytochrome P450 is making them feel really unwell, it is something you can consider to get a healing crisis under control very, very quickly. Now, on the flip side of this, your patient may actually show up on a functional liver detoxification profile as having an underactive phase 1. In essence, this is demonstrating that their liver is getting worn out. It's kind of like the equivalent of chronic fatigue or adrenal exhaustion is to our HPA axis. Low phase 1 is a demonstration of the liver failing to keep up with whatever the workload is. This is typically because of chronic and prolonged exposure of drugs, especially things like antihistamines, antifungals, antibiotics, benzodiazepines, and medications like H2 blockers and SSRIs. Now, in terms of phase 1 detoxification, you also have to consider genetic polymorphisms, or the genetic differences in the ability of an individual to metabolize xenobiotics. This is related to the presence of different versions of gene encoding for that particular activity. One example of this is variations that exist in the CYP1A2 gene. Over 50% of the population carry the variant 1F, making them slow metabolizers. One of the chemicals that is metabolized via this pathway is caffeine. In slow metabolizers, 2 to 3 cups of coffee significantly increases the heart attack risk. Genetic polymorphisms may in fact then explain why some patients have a different outcome with herbal treatments or pharmaceutical treatments, or why in some studies lots of caffeine intake is associated, or coffee intake is associated with good health, whereas in this case, even a small amount of coffee intake is associated with a negative cardiovascular outcome. Now, this slide here is a summary of some of the major CYP450 pathways and the relating drugs or chemicals or toxins that they're responsible for detoxifying. Because an individual's ability to metabolize toxins varies so much according to their genetic coding, understanding their typical genetic variants will enable you to personalize their detoxification program and minimize the risk of a healing crisis. Now, polymorphisms may also show up in phase 2 detoxification. For example, not only a variant of CYP2D6 may increase Parkinson's disease risk, but impaired acetylation, or the phase 2 activity of N-acetyltransferase, can also cause slow metabolism. Now, with this genetic variant, an increased production of reactive oxygen species, or oxidative load, is the resulting cause of the early onset Parkinson's disease, and in some cases Alzheimer's and other cancers are heavily influenced by this pathway. Looking now at phase 2 liver detoxification, or the next step in that production line of toxic metabolism. Phase 2 refers to a number of enzyme systems through which the liver then attempts to conjugate a toxin. It's heavily nutrient and amino acid dependent, but in this way the conjugate allows the toxin to be able to be excreted, whether that's through the bile from the liver, out through the gastrointestinal lumen in the stool, or directly from the kidneys out through the urine. Now, there are a number of pathways to consider, including glutathionation, glucuronidation, glycination, methylation, and acetylation. Now, each one of these pathways has its own forte, so to speak. For example, glutathionation is predominantly the pathway through which pesticides are excreted, paracetamol and toxic metals such as mercury, cadmium, and lead. Alcohol is also excreted via this pathway. This pathway heavily relies on methionine and selenium. It also benefits from curcumin and flavonoids and alpha-lipoic acid, and anything that helps to support glutathione production, including the 3 amino acids that it's made from, cysteine, glutamine, and glycine, will help to support and stimulate this pathway. Glucuronidation is one of the predominant pathways for the excretion of sex hormones, in particular estrogens, so one to consider when a patient is demonstrating excess hormone levels or dysregulated hormone levels. And this particular pathway benefits from things like magnesium and zinc, B vitamins and essential fatty acids, as well as cruciferous vegetables. Now, one pathway to be particularly mindful of is sulfation. Any time where any of the phase 2 pathways is failing to cope with its workload, sulfation steps in as its support team. What this means is, in the context of a detoxification program, is that sulfur must be readily available and an abundant supply to help support this particular pathway. In fact, sulfur is required for a whole number of phase 2 enzymes. Now, sulfation is particularly susceptible to inhibition with patients with compromised nutrient status. In particular, fasting individuals find their sulfate levels drop. High consumption of substances that are metabolized by sulfation, for example paracetamol, also increase the requirement for sulfur. What this means is fasting's never a great idea in detoxification, and an abundant supply of amino acids, as well as sulfur, is particularly important for liver support. Another critical consideration is ensuring adequate glutathione status in the body. Because detoxification is a process by which a lot of reactive oxygen species and oxidative stress is created, our own endogenous antioxidant is absolutely essential for protecting the liver and, in fact, all cells from the damage of this process. Glutathione is not only a great antioxidant, but a powerful anti-inflammatory. It's depleted in many disease states as well as through the course of aging. What research has revealed is glutathione levels typically are inversely correlated with the disease severity in chronically ill patients. Conversely, improving glutathione status in unwell patients improves the overall outcome and sense of well-being. Now, glutathione building blocks include the amino acids L-glutamine, L-cysteine, and L-glycine, so these are an important consideration as part of a detoxification program. In addition to this, glutathione peroxidase is a selenoprotein, which means selenium is essential for its activity or function. On top of that, you can consider such things as sulforaphane, which helps to induce glutathione S-transferase. Milk thistle also helps to boost intracellular glutathione and upregulates glutathione enzyme function. Also consider alpha-lipoic acid, as it recycles glutathione peroxidase, as well as being a fat and water-soluble antioxidant in and of itself. In addition to this, gentle exercise also boosts glutathione production. So light walking or gentle swimming also is an important part of a detoxification program from both moving lymphatic material around the body as well as boosting our own antioxidant status. Now, the liver is obviously a key part of detoxification. However, no detoxification program is complete without gastrointestinal support. It is critical to look after the gut in a detoxification program. So critical, in fact, it must be done first. The gut is not only a physical barrier against exogenous toxins that we ingest, as well as the toxins our liver is excreting, but 20 to 25% of detoxification actually occurs in the lining of the gastrointestinal tract. Cytochrome P450 enzymes, as well as phase 3 or anti-porter proteins, help to detoxify and eliminate and eject toxins at that barrier, preventing their absorption into the body or the requirement for the liver to get involved. It's heavily dependent on glutathione levels, and its activity is reduced in the course of inflammation. What this means is for anyone suffering with digestive upset, or in particular conditions like irritable bowel syndrome or Crohn's disease or ulcerative colitis, their ability to detoxify is compromised. Now, microflora in the gut also play a role in gastrointestinal detoxification. Through competitive inhibition and also reducing the toxic load that pathogenic bacteria can produce, they help to buffer the toxic load before it even reaches the gastrointestinal tract. They're also able to bind heavy metals directly, making them less available for absorption and easily excreted through the stool. Microflora also help to prevent the translocation of LPS and toxins across the gastrointestinal tract, which also in turn reduces the pressure on the liver in terms of detoxifying endogenous and exogenous toxins. Now, looking specifically at phase 3, this is literally the transport of toxins from within the cell out of the cell. Now, when you're looking at the liver specifically, in many cases after phase 2 metabolism is complete, toxins may diffuse passively by osmosis into the bile for excretion via the gallbladder and the lumen of the gut. But in some cases, they must be actively transported across the cell membrane, which is where the phase 3 or anti-porter proteins come in. Anti-porter or phase 3 enzymes are also present in the lungs and the kidneys, as well as the intestinal tract, also playing a role with the physical ejection of chemicals and toxins from the cell into the lumen of the gut or into the breath or into the urine for excretion directly. Now, there are a number of things that can impair phase 3 activity as well. Intestinal inflammation disrupts this detoxification pathway in a couple of ways. First of all, it downregulates MDR transporters, which are responsible for ejecting some toxins across the cell membrane. Intestinal inflammation also reduces glutathione activity in the intestines, which is a really important antioxidant for preventing a healing crisis and free radical damage. Now, what's interesting is impaired phase 3 and intestinal inflammation affects phase 2. Now, this is a protective mechanism by the body, which makes sense. If the gastrointestinal tract is inflamed, and there is an increased risk of translocation of things like LPS or ingested toxins across the gut wall, the liver is not going to continue its detoxification process and excretion of toxins into the bile down into an inflamed gastrointestinal tract. So as a result, it downregulates glutathione conjugation, sulfation, and glucuronidation to take the pressure off the gut so that it may repair. But what this means is if you don't take care of the gut first And in particular for those that have gastrointestinal issues, you already have a liver that's under stress that requires extra support in the form of gut repair first. So now let's take a look at what happens if our detoxification systems are compromised or toxic load climbs past a manageable level for us. Now, the impact of toxic overwhelm can manifest as short-term signs and symptoms, as well as eventual long-term negative health outcomes. Now, some indicators of toxic overwhelm may appear as recurrent headaches. Things like chemical sensitivity, so people who tend to be more reactive to pharmaceutical medications, who may react with headaches or nausea in response to perfumes or petrol fumes, as well as increased allergies. Now, things like lethargy or muscle aches and pains and weakness can also indicate an overwhelmed toxic system. Gastrointestinal dysfunction is another big indicator, as are chronic skin issues like acne, psoriasis, and eczema. Nausea can also indicate a liver that's finding it difficult to deal with the toxins that it's being presented with, and issues with short-term memory and concentration, and even something like anemia can indicate toxic overwhelm. Now, long-term, this can lead to mood disorders like depression, anxiety, or things like mood swings. It can also contribute to subfertility or infertility through the irregularity with hormone production and metabolism. Paresthesias, neuralgia, things like chronic fatigue, and cardiovascular disease can also be a result of toxic overwhelm that has been prolonged. Cancer perhaps being the best example of this. Now, in terms of being able to assess how somebody's detoxification systems are working or where they might be failing, there are a number of other assessments you can do, including the functional liver detoxification profile I referred to earlier. Intestinal permeability is perhaps one of the more popular assessments to do. This is essentially picking up whether there's leaky gut present and to what degree. And it's the way in which it works is 2 different sized sugars are ingested, mannitol and lactitol, and the resulting metabolites are picked up in the urine. Now, in the case of mannitol, this is a small absorbable sugar that should appear in the urine after ingestion. Lactitol, on the other hand, is a large sugar that, in the presence of an appropriate gastrointestinal permeability or integrity, should not be able to be absorbed and therefore should not appear in the urine after ingestion. An organic acids intestinal dysbiosis panel is perhaps the next step up, which actually assesses any fungal, bacterial, viral overload in the gastrointestinal tract. And of course, in addition to this, you could consider a parasitology test or a CDSA, or a comprehensive digestive stool analysis, which also assesses how well someone's body is digesting macronutrients. Estrogen metabolites might be important for someone who is suffering from hormonal irregularities, whether it's in their cycle, through PMS, or perhaps issues with falling pregnant. And porphyrins are also important when you're considering heavy metal overwhelm. They will show up when the body is increasingly trying to detoxify heavy metals. Now, I want to draw your attention to some of the other key indicators that the body may be dealing with toxic overwhelm. The thyroid in particular is very vulnerable and sensitive to exogenous toxins. The liver also plays a major role in thyroid function, and in this way, toxins can influence the thyroid in a secondary manner. For example, the role of the liver is such that it converts the thyroid hormone, T4, into its active form, T3. Now, anywhere where the liver function may be compromised, this activation of thyroid hormone into its active form could be compromised as well. Now, the liver is also responsible for synthesizing transport proteins that carry T3 and T4 around the body, and is also responsible for the metabolism of reverse T3. Now, reverse T3 can actually have a counterproductive effect on T3 by inhibiting its functioning at a cellular level. In addition to that, reverse T3 can bind T3 receptors, directly blocking that hormone. And the trouble is the conversion of T4 to reverse T3 is not selenium dependent. So typically in a selenium deficient patient, you can have additional complications as well. Now, inflammation and stress, or more specifically elevations in cortisol levels, are also associated with low T3 and high reverse T3, which can then result in a patient that appears to have low thyroid function, even though the traditional blood tests may not demonstrate such an obvious picture. Now, in terms of euthyroid syndrome or low T3 syndrome, this is commonly a result of alterations in peripheral thyroid hormone function and metabolism as opposed to an inherent problem with the thyroid itself. The first place, of course, that you need to look is with the liver function. But in addition to that, you can consider including things like selenium, which are important for the appropriate conversion of hormones. And in fact, with Hashimoto's disease and autoantibodies in pregnancy, selenium was able to decrease antithyroid antibody levels and also improve the overall structure of the thyroid gland as determined by an ultrasound. On the other side of the coin, in Graves' disease or hyperactive thyroid activity, selenium is also having a beneficial effect on reducing the inflammation and orbitopathy that occurs in this particular condition. Now, toxins can have a direct effect on thyroid function as well, or more specifically, thyroid hormone activity. There are many different ways in which it can do this. For example, xenobiotics can displace T4 from serum-binding proteins. So the serum-binding proteins are the carriers or the transporters of this hormone around the body. Now, free T4 is an issue that the body then has to detoxify and eliminate, thus actually excreting a very important hormone because it's no longer bound to the appropriate protein. Salicylates and PCBs can do this also, bearing in mind that xenobiotics and other endogenous and exogenous toxins upregulate many of the enzymes the liver uses to detoxify those very chemicals, which also accelerates the excretion of T4. Now, xenobiotics may also alter the structure of thyroid receptors, which means it will not function in a way that it typically would when T3 actually binds to it. Now, the consequences of this is very difficult to predict, and in some cases, cancer is a potential outcome. But what it means is, in spite of an appropriate blood test levels and assessment, someone may still exhibit signs of underactive thyroid activity. In addition to this, chemicals can also lower circulating levels of nutrients. Now, looking at thyroid dysfunction specifically, a reduction in vitamin A has an impact on thyroid function or our ability to respond to thyroid hormone. For example, the receptors are retinoic X receptors, which means in the presence of insufficient vitamin A, the body doesn't respond to thyroid hormone in the same way. On top of that, cigarettes, for example, contain thiocyanates. This inhibits iodine uptake at the cellular level. And BPA, or bisphenol A, which is a common compound found in plastics, not only is an endocrine disrupting chemical, particularly having a xenoestrogen effect, it also binds and antagonizes T3 activation. BPA exposure is also associated with thyroid resistance syndrome, which commonly occurs with ADHD, and sadly, being detected in amniotic fluid, cord blood, and breast milk can mess with thyroid function in a child before they're even born. On the subject of babies, male infertility can also be a key indicator of toxic overwhelm. Oxidative stress is a major outcome of toxicity, as is inflammation, and as a result, sperm are very, very sensitive to reactive oxygen species, therefore affecting their morphology and their ability to swim. Now, on top of that, the thyroid is related to fertility in that T3 stimulates the production of Leydig cell LH receptors. It's also responsible for driving the secretion of testosterone, as well as a host of other related effects, including sperm health. Now, oxidative stress is a common pathology in over half of all infertile men. The damage that the reactive oxygen species causes to the sperm membrane not only reduces its sperm motility, but its ability to fuse with the egg. On top of that, alterations in sperm DNA can result in the passage of defective DNA onto the child, which could mean potentially hazardous genetic outcomes once the baby is born. On top of that, sperm health drives the health of the placenta and therefore is partly responsible for the length and the quality of the pregnancy as well. So anywhere there is infertility or subfertility on the male side, oxidative stress is key. Toxic overwhelm may well be the primary source, and consider the impact that has on the thyroid function as well. Now, in terms of women, estrogen dominance is a sign of not necessarily a malfunctioning production of hormones, but an issue with the liver in terms of excretion, conjugation, elimination, and also that overwhelming build-up from exogenous toxins. As is the case with any detoxification program, gastrointestinal function is critical, followed up by liver function. Now, in particular, this needs to be considered with any form of PMS, menorrhagia, endometriosis, or polycystic ovarian syndrome. Of course, ensure BPA exposure is minimised because that has a xenoestrogenic effect. Phase 2 liver detoxification support is important, as well as down-regulating systemic inflammation. Now, this is key because systemic inflammation upregulates aromatase activity, which further drives estrogen dominance and a dysregulated hormonal profile. Being overweight also upregulates aromatase activity, as can some nutrient deficiencies. So this is an important consideration when dealing with estrogen dominance. In addition to that, dysbiosis is another part that must be considered carefully when looking at estrogen dominance. Dysbiosis leads to a higher beta-glucuronidase activity. What this means is hormones or estrogens that are being excreted by the liver through the bile into the gut are then deconjugated, cleaved away from their glucuronic acid conjugate so that they can then be reabsorbed back into the liver, further contributing to hormonal overwhelm. Conversely, appropriate microflora or healthy commensal population of bacteria can reduce this beta-glucuronidase function, thereby reducing the hormonal load on the liver and supporting its ability to excrete excess hormones. Now, with toxic overwhelm, there is also a link with autism, neurological and mood disorders. We have to consider also the source of things such as exorphins. Now, exorphins are opioid-like peptides that are derived from food proteins that have a very similar structure to endogenously produced opioids. What this means is things like wheat or dairy products are a potential source of toxins to the body, which can influence neurological and mood disorders, particularly things like schizophrenia, as well as depression and anxiety. Interestingly, depression has major inflammatory and toxic drivers, and in fact, increased passage of LPS, or lipopolysaccharides across the gut wall, contribute powerfully to anxiety, depression, and cytokine sickness. Heavy metal toxicity is also associated with depression, mercury in particular. Specific polymorphisms may influence an individual's sensitivity to these heavy metals as well, which contributes to symptom severity. Looking at mercury specifically, typically a potential weekly exposure could very easily exceed that which is considered the maximum allowance for good health, which is currently considered 200 micrograms. For example, if someone has a mercury filling or a dental amalgam which uses mercury, there is the potential for ingestion of up to 140 micrograms per week just by the dissolution of that amalgam alone in the mouth being swallowed through the saliva. Now, the consumption of fish, like large fish including shark, swordfish, tuna or marlin, could be a large source of methylmercury in the diet. For example, just 2 servings of fish of 200 grams each may provide enough mercury to account for 200 micrograms per week. So this simple little combination may end up meaning a person is toxically overwhelmed by this one heavy metal, not even looking at any of the other sources of toxins in their diet. Now, there are some nutrients that should be specifically considered when dealing with mercury toxicity. Selenium specifically is a really important one because it activates glutathione and superoxide dismutase and metallothioneine. This is important to deal with the reactive oxygen species that is created in terms of heavy metal toxicity, or specifically mercury in this case. On top of that, however, selenium binds one-to-one with mercury to render it an inert, non-toxic salt, so a critical element when dealing with mercury toxicity. Alpha-lipoic acid is another must-have because it increases biliary excretion of mercury. It also increases urinary excretion of mercury and helps to regenerate and recycle our glutathione levels. N-acetylcysteine is another important consideration to help provide a binder to mercury for biliary excretion. Now, migraines and chemical sensitivities are another condition or disorder or set of that should be considered when you're looking at a detoxification program and the influence that toxins might have. For example, there are many naturally occurring chemicals in food, like salicylates or glutamates or amines, that may trigger off migraines. Chemicals that are found in things like food, like MSG or artificial colours, as well as chemicals found in fragrances, are also important to eliminate in the case of chemical sensitivities and or migraines. Supporting the sulfation pathway is always important for people who are sensitive to certain chemicals or foods or other sort of toxic elements, because that is the pathway that is going to support all of the others. Looking specifically at migraines, however, of course you must rule out any structural factors, for example, subluxation or misalignment of the neck or spine, and also consider such things as magnesium. Magnesium has been found to be a powerful nutrient in managing migraines. It can be used prophylactically, particularly for stress or tension-related headaches, and is also administered at the time of the prodromal aura, can abort a migraine. Now, CoQ10 and B2 are also important considerations that have been proven to be useful in reducing the frequency with which migraine might occur, and also the severity of a migraine in the event that it does occur. So now we have a really good understanding of what exactly toxicity is, where it comes from, and how we might best identify the sources of toxins that we can influence or remove in our patient's lifestyle, whether it's food, water, or environment. We now have a very intimate understanding of the different detoxification systems our body uses to eliminate these sources of toxins. We also now have some key identifying signs, symptoms, and conditions that might be a red flag to us as practitioners that our patients are actually suffering from toxic overwhelm, which leads us to this last section of the seminar, what do we do about it? Which is where I would like to introduce you to our Heal and Seal, Cleanse and Clear programs, also called HSCC program for short. Now, this program is not just one program, but is a core program around which are built add-on extras to help customise for your patient's individual needs exactly what they require. Now, to support you in this, we have got a practitioner booklet, which provides the outline for all of these different treatment guidelines. There are also patient booklets available to you in which you can actually detail to your client in writing exactly what they need to take and when and how. Let's begin with looking at the HSCC core program, the backbone around which all of the added extras are built. Based on what we've learnt today, healing and sealing the gut wall must be done first before we touch any of the other detoxification systems. So week 1 and 2 is aptly named Heal and Seal. This is a really simple stage that lasts for 14 days that includes just 2 products, Intestamine and SB Fluoractive, and they are designed to repair the gut first, to optimise the integrity of the gut, and also begin to deal with any dysbiosis that is likely to be present. Let's have a look at what's actually in these particular products, starting with Intestamine. Now, one of the key ingredients in Intestamine, or our upgraded formula, if you are familiar with the old one, is mastic gum. Now, mastic gum is this incredible resin from the mastic tree, which is a powerful modulator of inflammation in the intestinal epithelium. Now, this is important because not only does the gut have to be in optimum condition to prevent the translocation of toxins coming out from the liver, but intestinal inflammation downregulates phase 2 and phase 3 detoxification, thereby compromising liver function. Mastic gum is also a powerful inhibitor of oxidative stress and induces healing and regeneration and renewal of the gastrointestinal epithelium. It's able to reduce a number of inflammatory mediators, and the fact that it has potent antimicrobial properties, including antibacterial and antifungal, makes it a holistic plant option for treating leaky gut and beginning to induce that gastrointestinal detoxification. You get 11 grams per serve, so this is perhaps the key ingredient in antihistamine, which is able to not only reduce toxin absorption across the gut wall, but also LPS translocation. Curcumin is another important element of antihistamine. At 1.5 grams per serve, it is providing a powerful anti-inflammatory mechanism. It's able to downregulate cyclooxygenase 2, or COX-2, as well as lipoxygenase and inducible nitric oxide synthase. It also inhibits a number of inflammatory chemicals, including tumor necrosis factor alpha and a number of the interleukin chemicals as well. It can reduce the potential for mucosal injury, and in addition to its gut-specific activity, it's able to enhance liver detoxification by increasing glutathione S transferase. So it helps to remove that toxic load from phase 2 and enhance glutathione status, preparing the liver for the next phase of detoxification. Now, no gut repair formula would be complete without glutamine, and per serve, antihistamine provides 2,000 milligrams of glutamine. Now, it's a primary fuel source for a number of cells, including lymphocytes and macrophages, but it is critical for the replication and renewal of enterocytes, or literally the cells that line our gut wall. On top of that, it increases brush border enzyme activity and increases villus height, density, and weight. Now, this is really important for the digestion and absorption of nutrients, as well as, shoring up the integrity of that barrier against ingested toxins. It prevents hyperpermeability and therefore translocation, and as a critical part or constituent of glutathione, helps to serve to reduce the load of reactive oxygen species as well. Now, antihistamine is also a great source of fibre, particularly water-soluble mucilaginous fibre, including slippery elm and aloe vera. Now, these are important for a number of reasons. Firstly, fibre is like an intestinal broom that sweeps out toxins in a physical manner, but it also behaves like a sponge, collecting and securing, if you like, toxins that the liver is excreting via the bile. On top of that, the mucilages have a nice calming, soothing and healing effect on the intestinal tract. As a result, this formula is often used for dyspepsia, troubles like constipation and diarrhea, but in the context of the HSCC program, it's there to reduce inflammation of the gastrointestinal tract, treat leaky gut, and help to shore up the intestinal permeability so that the barrier is intact, ready for phase 2 of the HSCC program. In partnership with antihistamine, we also recommend Saccharomyces boulardii. Now, Saccharomyces boulardii is the most researched probiotic in the world and the first one that must always be used to correct dysbiosis because of its unique way or number of ways in which it helps to restore the integrity of the gut. Now, not only is it able to physically displace candida, as well as other pathogenic fungal and bacterial issues, it also improves the immune response by downregulating inflammatory chemicals and increasing interleukin 10, which is an anti-inflammatory cytokine. On top of that, it stimulates and in fact is the most powerful inducer of the production of secretory IgA. Secretory IgA is the only anti-inflammatory immunoglobulin we have out of those of which we have to choose from. Secretory IgA is important for a number of reasons, including the prevention of the adherence of pathogenic bacteria or viruses or fungi to the gut wall. It also, of course, downregulates inflammation in the lining of the gastrointestinal tract, but also contributes to the stimulation and production of biofilm. Now, biofilm is a sticky mucopolysaccharide-rich paste or secretion that is produced at the lining of the gut wall, which provides a home for our commensal bacteria, a critical place for them to anchor and proliferate, thereby imparting the beneficial effects that are associated with probiotic bacteria. On top of this, Saccharomyces boulardii contains polyamines, which have a trophic effect on our intestinal tract, increasing the length and the weight of our gut, as well as increasing brushwater enzyme production, lactase being perhaps one of the most important ones. Now, on top of that, intestinal health may well require some additional nutrients. Vitamin A and omega-3, for example, are also important constituents of the biofilm. Omega-3 is a great anti-inflammatory, and quercetin is another important nutrient to help reduce mast cell degranulation and histamine release. In doing so, it reduces the disturbance of the barrier of the gut and reduces intestinal inflammation. Vitamin D might also need to be considered, given that the prevalence of deficiency is an issue. It enhances transcription of cathelicidin, which is an antimicrobial peptide, very important for keeping pathogenic microbes at bay, and it must be present in order to be able to address any kind of infection or injury at the epithelial layer. Zinc in combination with vitamin A should also be considered to help accelerate mucosal regeneration. It's critical for mucous membrane integrity and may well need to be, prescribed in addition to these two products in the event someone's diet is insufficient. In most cases, a human strain commensal probiotic formula will be prescribed in week 5 of the program, but in severe dysbiosis or gastrointestinal distress, you may want to consider including an additional probiotic to help enhance desirable substance production like short-chain fatty acids, butyric acid being a really important short-chain fatty acid for colonocyte replication and renewal. And interestingly, short-chain fatty acids also enhance hepatic fat metabolism, and thereby may actually help support lipid-soluble toxin excretion. So that's the first 2 weeks. Antihistamine administered at between 1 to 2 teaspoons a day, or a 5-gram dose, and SB Fluoractive at the therapeutic dose of 4 capsules a day is the ideal way to help restore and repair the gastrointestinal barrier. Now, in some cases, you may need to extend this program a little bit longer. So for those that suffer from Crohn's or irritable bowel syndrome or ulcerative colitis, or perhaps have had recurrent bouts of gastrointestinal infection or other complications, you could consider even doubling this part of the program before moving on to the cleanse and clear. But assuming you have completed this part of the program, the patient's doing well, feeling great, is having regular bowel motions, and is coping with the program, the next step is to move on to phase 2, the cleanse and clear the liver, which occurs over week 3 and 4. Now, at this time, I'd like to point out that SB Fluoractive is still an important component of this prescription. The reason being is at 1,000 milligrams a day, or 4 capsules a day, takes about 3 to 4 weeks to bring secretory IgA production up to sustainable therapeutic levels. But what you do see here is the introduction of Aminoplex Cleanse and the elimination of antihistamine. We'll explore what's an Aminoplex Cleanse in a moment, but on top of those 2 products, we also introduced Lipotone, which is a herbal liver support formula made up of predominantly milk thistle with some supporting herbs. Looking at Aminoplex Cleanse first. This is a smoothie mix with a large range of beneficial compounds for detoxification. It's based around rhizotine rice protein, which is an organic sprouted brown rice protein, which we'll explore more in just a moment. But it's supported by vital greens, including spirulina, cracked chlorella, and broccoli sprout powder. And of course, the liver is hereby stimulated through the inclusion of dandelion root, globe artichoke, and of course lipotropic factors, which are important for that metabolism of toxins from the liver into the bile and out into the gut. Gastrointestinal repair and replication is further supported by the inclusion of glutamine. Now, a rhizotine rice We've chosen this as our source of amino acids for phase 2 liver support because it is the highest quality rice protein that we could get our hands on. Not only is rice protein hypoallergenic, making it suitable for even your most sensitive patients, it has a complete amino acid profile with high biological value and is very high in branched chain amino acids. Now, this is important because di and tripeptides are taken up and utilised far more efficiently than single amino acids. And the way in which ricetine rice is processed gives it a similar digestibility to whey protein. So it is unlike any other rice protein that you've seen. Now, not only is it from certified organic brown rice and has been sprouted to increase its bioavailability, it is processed in a very natural way that does not include typically used heat and toxic solvents like hexane. Of course, it is also free from other toxic sources like sulfates, sulfites, MSG, and gluten. So these amino acids provide those important elements for conjugation of phase 2 liver detoxification. But moving on to look at the phytonutrient support, let's have a look at broccoli sprout extract. Now, broccoli sprout extract is a potent inducer of phase 2 detoxification enzymes. Sulforaphane is the predominant element here. Sulforaphane is an isocyanate found in cruciferous vegetables, but is particularly high in broccoli sprouts. In fact, broccoli sprouts can contain anywhere between 10 to 100 times higher concentrations of a sulforaphane precursor called glucoraphanin than mature broccoli plants. Now, it's commonly studied for things like cancer prevention, but in the context of detoxification, sulforaphane specifically helps to boost glutathione S-transferase and glucuronyl transferases, really important phase 2 detoxification enzymes. Now, unfortunately, whilst you can include cruciferous vegetables in your diet as a source of sulforaphane, this particular compound is vulnerable to heat and can be destroyed or lost from boiling, and as a result is best consumed either raw or lightly steamed or blanched. Now, it's interesting to note that when taken in combination with probiotics, the bioactives from broccoli sprout actually become more available. So SB Fluoractive will be helping to support this particular activity of aminoplex. Now, you should consider adding cruciferous vegetables to the patient's diet during detox and encouraging them to continue it afterwards in the forms of the brassica vegetables, things like Brussels sprouts, watercress, cabbage, and kale, which seems to be flavour of the month. Now, broccoli sprout extract and the sulforaphane it contains is supported further by cracked chlorella. Now, chlorella is this incredible algae which is a potent source of chlorophyll, both type A and type B. It's a highly nutritious source of protein and therefore sources of amino acids for phase 2 detoxification, but also specifically helps cellular detox and energy production. It binds to heavy metals like mercury, lead, and cadmium. It's able to clear certain toxins like PCDDs, as well as dioxins which are found in bleaching personal care products and paper, in food and in cigarettes. Interestingly, it's also able to reduce radiation damage, as well as retard tumour progression. So in this way, it really is a powerful little compound, but what's interesting to note is the cell wall of chlorella must be cracked in order to be able to absorb the nutrients and other compounds that it provides. So obviously in Aminoplex Cleanse, we've ensured that chlorella is a cracked source. Now, another super algae that we've included is spirulina, which is another highly nutritious seaweed, which is a unique blue-green colour. It's over 65% protein and also a great source of phycocyanin, beta-carotene and antioxidants. So another cellular cleansing compound. Now, these greens are supporting the phase 2 detoxification by the liver. But what the liver also needs to do is, once this process is complete, to actually excrete these toxins through the bile into the lumen of the gut. So herbs that stimulate the flow of bile are an important inclusion in Aminoplex Cleanse. Dandelion root is one of the standard and most important liver herbs to utilise in a detox. It increases the production and flow of bile, and what's interesting is it's able to calm down the activity of some of the phase 1 enzymes whilst dramatically increasing the levels of some phase 2, so it provides a balancing effect on the liver as well as a cholagogue and choleretic effect. Globe artichoke is also included for its cholagogue and choleretic properties. It's also a great antioxidant to protect against chemically induced insult to the liver and helps to diminish the loss of cellular glutathione reserves. So the pairing of these two major liver herbs is critical for an effective detox. Green tea is also included in Aminoplex Cleanse. It's a potent source of EGCG, or epigallocatechin gallate, which is the most abundant catechin in green tea. Now, catechins are, at least in part, responsible for green tea's hepatoprotective activity. Green tea also enhances glucuronidation and helps to downregulate many of the cytochrome P450 enzymes, not just in the liver, but also in the intestines, allowing phase 2 liver detoxification to catch up. Interestingly, it also potentiates the effects of sulforaphane. On top of that, it's a fantastic anti-inflammatory which reduces NF-kappa B and COX-2, as well as improving cell differentiation and reducing LPS-induced systemic inflammation. They are the heroes, if I can call them that, of Aminoplex Cleanse, but they are supported by a number of cofactors which also contribute to the detoxification effects of Aminoplex Cleanse. We've included zinc and vitamin A, which are critical not only for immune function but epithelial cell integrity, and vitamin A specifically also contributes to biofilm. Digestive enzymes have been included, vegetarian enzymes they are, to reduce dietary antigens and therefore the potential for increasing toxic load. They help to improve digestion and also enhance the bioavailability of all the nutrients that we're providing. Methionine, glycine, taurine and cysteine are also included in there as far as their properties relate to phase 2 liver detoxification and also glutathione synthesis. Now, a perfect pairing to Aminoplex Cleanse is Lipotone, which is our herbal liver antioxidant formula. Each tablet contains over 5,000 milligrams of milk thistle, further supported by schizandra, bupleurum, turmeric and globe artichoke, as well as taurine for bioconjugation. Now, milk thistle is perhaps one of the most famous liver herbs, and for good reason. It is a powerful liver protector, acting as a buffer against toxin-induced damage. Now, its hepatoprotective effects are related to the fact that it's an antioxidant. It also boosts our own antioxidant concentrations of glutathione. It also increases hepatocyte protein synthesis and therefore hepatic tissue regeneration, and helps to regulate cell membrane permeability and increase its stability against xenobiotic injury. Now, what's interesting is milk thistle also helps to rebalance the coupling between phase 1 and phase 2. What I mean by that is it can calm down some overactive cytochrome P450 phase 1 enzymes while helping to gently upregulate phase 2 to improve that production line of toxic metabolism. It's further supported by schizandra, which also has hepatoprotective effects. It specifically helps to protect the liver against viral assault and chemical assault, as well as mercury toxicity. Schizandrin B, one of its active constituents, also enhances the efficiency of hepatic glutathione production. Now, bupleurum also helps to boost glutathione levels, as well as enhancing another one of our natural antioxidant enzymes, superoxide dismutase. In addition to this, the fibre in Aminoplex Cleanse, like I mentioned before, behaves like a broom sweeping out the intestinal tract and acts like a sponge absorbing toxins that are coming out through the liver. Slippery elm bark, obviously being a soluble fibre and a mucilaginous fibre, has a demulcent-like effect, but On top of that, fibre also provides a prebiotic material which enhances short-chain fatty acid synthesis. For those who might have an issue with stool transit time, whether it's too quick or too slow, obviously look at their water intake, and in the context of a detox program, it's even more critical, but you may want to consider additional fibre sources if their diet is insufficient. That concludes the second stage, or the cleansing and clearing part of the HSCC core program, at which point, if you're satisfied with the patient's progress, you could then put them on the wrap-up program. And what that involves is including a human strain commensal probiotic high-potency CFU count, and in this case, we've recommended Ultrabiotic 45. This is going to provide a high-potency probiotic, or levels of probiotic bacteria specific for both the small intestine and the large intestine, to set up and colonize the bowel and impart long-term protective effects, as well as all the other benefits that a probiotic provides. You continue with Lipotome until the bottle is finished, and at this point, if they're not already taking a multivitamin, you can add that in to provide nutrient support for ongoing liver maintenance. Now, once Lipotome is finished, we encourage you to advise your patients to continue on some sort of antioxidant formula. Now, there are a whole host of different choices you might make, and what one is right for your client might vary depending on what their individual circumstances are. But as a generic recommendation, Antioxic Cell is a great source of antioxidants, both vitamin, mineral, and herbal and phytonutrient, that provides an all-round comprehensive formula for general maintenance and well-being. So that really sums up the HSCC core program, which is a great program for your average Jane Doe or Joe blogs. But many of us don't see uncomplicated cases and may have extra or additional issues that the patient needs addressing, and in the context of a detox program, may be perfect time to introduce some extra elements to support their body with whatever they're dealing with. So in that case, we have extra guidelines around intensive gastrointestinal tract care, endocrine or hormonal imbalances, immune issues including allergies and inflammation, and also specifically heavy metal toxicity. Just reiterating, the fact that a quarter of all detoxification occurs in the gut, and the gut must be in optimal condition before we start cleansing and clearing the liver, these programs are ideally introduced at around the week 3 mark, with the exception of the intensive GIT repair program. Let's take a look at that one first. For inclusion in that first couple of weeks of gut repair program, you could consider including Gastrocare Excel. Now, Gastrocare Excel is an important consideration for gut repair for a couple of reasons. It's essentially a colostrum powder, and like all mammals, the colostrum is that first milk that is produced to heal and seal the leaky gut that we're all naturally born with. So it provides extra bioactive compounds that help to repair the gastrointestinal lining. In addition to this, it provides lactoferrin and lactoperoxidase, which help to address dysbiotic states. And on top of that, it's a source of IgA, or secretory IgA. So while SB Fluoractive is encouraging and stimulating the body's own production of secretory IgA, Gastrocare can supply and provide this immediately at the very beginning of the program. Consider dosing this at around the same as antihistamine, and in terms of an intensive gut repair program, you'd be using 2 teaspoons a day of antihistamine. You can include Gastrocare Excel at the same time, and that way you're covering both your bases. Now, in the event someone has got a parasitic infection, you could consider Paraceia Forte as a source of wormwood and barberry. It's a great herbal formula for killing off as broad-spectrum parasites. Now, the dosage of it is 1 to 2 capsules twice a day, and this is where you might extend that heal and sealing program for a little bit longer. Antiparasitics are ideally administered for a couple of weeks, then followed by a 1-week break. You can re-administer for another couple of weeks. And in this way, you can actually capture any hatching eggs as they come through. Moving on to look at endocrine or hormonal irregularities, for women you could look at something as simple as Vitex. Now, Vitex administered once a day in the morning can be enough to restore appropriate menstrual cycles, or you might need to use a little bit of a higher dose. Now, in the case of PCOS or endometriosis or more severe menstrual dysfunction, Femplex is an ideal consideration at 1 tablet twice a day to restoring appropriate estrogen and progesterone balance. Now, at the other end of a woman's menstrual cycle, Menoplus 8PN is a fantastic herbal formula that is designed to alleviate the symptoms of women going through menopause, predominantly hot flushes, but all of those other ones are included in there as well. Now, in the event someone is suffering from thyroid issues, underactive thyroid or euthyroidism, Thyroplex is a great formula to help enhance thyroid activation and thyroid receptor sensitivity. So 1 tablet twice a day may be all you need to include just to help restore balance in that particular patient. Now, in terms of allergies and inflammation, if the patient is not already taking a fish oil supplement, it would be wise to include an omega-3 source in the form of whether it's OmegaSure, our liquid fish oil supplement, or Ultra Clean EPA DHA+, to provide those anti-inflammatory eicosanoids. It also has the added advantage of providing another compound important for biofilm production. Now, quercetin is a fantastic tablet to help downregulate histamine production and is perfect for any of those type of allergy reactions, so food sensitivities, histamine reactions, those that are suffering from hay fever or contact dermatitis. Now, D3 drops are also an important consideration where there is immune dysfunction of any nature, and lactoferrin plus SB could be considered in addition to or as an alternative to SB fluoractive in those with compromised immune systems. Lactoferrin, when it comes into contact with our stomach acid, is converted into lactoferricin, a powerful antimicrobial. And perhaps it's for this reason that lactoferrin plus SB seems to have such a positive impact on those suffering from chronic skin disorders, particularly those of an infectious type nature. Acne vulgaris is the best one that springs to my mind. Now, in terms of systemic inflammation, we have got Inflammease Active and Inflamzyme as a powerful duo at reducing inflammatory cytokine production and also keeping in check the ultimate inflammatory instigator, NF-kappa B. These are ideally used in combination. Inflammease Active is a herbal tablet and should ideally be taken at meal times. And the herbal combination that it is designed to inhibit the release of NF-kappa B, which is the light switch that turns on the rest of the inflammatory cascade. Now, to deal with the result of the rest of the inflammatory cascade and the inflammatory mediators that are produced, Inflamzyme taken between meals is ideal to mop up and dissolve and reduce those circulating pro-inflammatory mediators. Heavy metal toxicity is the last program I'm going to touch on, and there are a number of considerations, and this is not an conclusive list, but selenium and zinc are critical elements for metallothionein and conjugation of heavy metals. Essential fatty acids, if they're not already included in the program, are also important to reduce the systemic inflammation that is caused by the reactive oxygen species as a result of heavy metal toxicity. Alpha-lipoic acid is another must-have in this particular context. Alpha-lipoic acid not only is a powerful fat and water-soluble antioxidant that recycles glutathione, but is also able to bind and chelate many heavy metals, even intracellularly, and in this particular case, is obviously indicated for heavy metal toxicity. Just one word of caution with alpha-lipoic acid. It's ideally absorbed away from other nutrients and food, so it's often recommended to be taken about an hour after dinner or an hour before bedtime. Be aware that, as the name suggests, it's highly acidic, and those with compromised stomach acid production or gastroesophageal reflux may actually experience burning pain if it's taken without food. In the event that that happens, obviously recommend it with a meal. Some final take-home patient tips. You can print this slide out as a checklist for your client if you wish. We've also gone into more detail in the patient booklet, but eating organic as much as possible is ideal. I guess to prioritise that in terms of, given that it's expensive, first and foremost, all animal products or fat-containing products should be eaten organic. All mammals store most of their toxins in their fat, thereby things like butter or meat products can potentially be a source of extra toxins if they're not organic. Any fruits and vegetables that are eaten with the skin on are also more important to get organic than those where you peel the skin off. Drinking enough water, drinking water correctly, is also an important part of avoiding a healing crisis, and ideally even an above-counter water filter or a jug water filter will help reduce the amount of toxins that they consume via the town water supply. Fish intake during a diet, any sort of healthy diet, is important, but make sure it's from low-risk species, and encourage dry skin brushing as well as plenty of rest, adequate sleep, and gentle daily exercise. Tea, coffee and alcohol are obviously not acceptable during a detoxification program, but of course pharmaceutical medications that can't be avoided must continue to be taken during the program. Detoxifying their environment's important, as well as stress management. And lastly, ensuring they're having a daily bowel movement will ensure the avoidance of a healing crisis. I'm Amie Skilton. That was Cellular Housekeeping. Thank you so much for listening.